Hello, my name is Dr. MarkAlain Dery, and I'm the Medical Director of Infectious Diseases and the Chief Innovation Officer for Access Health Louisiana. You've seen me do these updates now for the past 8 weeks in conjunction with the leadership of the ACOI, and I hope these messages are helping you to keep up with the latest on COVID-19. I know many of you are in the thick of the fight, and I'd like to thank you on behalf of all of us who are daily focusing on infectious diseases, and certainly on behalf of the ACOI. Now, I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. As we are facing this once-in-a-lifetime global battle, I want to hear from you, my colleagues who are experiencing the fight from their locations, no matter where you are in the country. I provide my contact information at the end of each update, so listen for that, and I hope you take me up on this invitation to reach out. Now, moving together with the ACOI, we will continue to share information as it becomes available, as well as some of the hopeful progress we are seeing. Also, for more information on the ACOI's new peer-to-peer well-being check-in sessions that are available free of charge to ACOI members, and might I add, these are really awesome, really good. Please go to the acoi.org/COVID-19 and click on the box so that you can find out how you can join in. They're really, really good. These Zoom sessions are an awesome way to feel connected and support during this challenging time. Did I mention that these are very, very good? All right, so let's talk about some of these repeatedly positive tests that we're seeing in our patients. So patients who are discharged from isolation after recovering from COVID-19 and who again test positive from SARS-CoV-2 are unlikely to be infectious. That's really good news. This is from a report from the Korean Centers for Disease Control and Prevention. Researchers there had identified 447 patients who again tested positive with PCR testing. And of those, 2/3 of these patients had undergone epidemiological investigation and contact investigation so they can follow up on them. And what they found was this. Now, among about half of those patients who were symptomatic, when their case was initially confirmed, a repeat positive test result after discharge occurred on average of 45 days after the initial symptoms developed. Wow, this was like, to me, this is like an incomplete clearance of a genetic viral material or particles from the nasopharyngeal mucosa. On a personal note, I had a patient who was still testing positive 60 days after onset of his symptoms. I told him to not get tested after he got better, but he went and got tested 3 or 4 times, and even though he was asymptomatic and even though he was doing well, elderly man, cleaning gutters, painting house, doing great, he was still testing positive. And what this very likely represents, again, is incomplete clearance of the nasopharyngeal genetic material. Now, the real question is to determine whether or not this is associated with being infectious. So the researchers then went ahead and did just that. So how did they do that? What they did is they went to the contacts of those who tested positive a second time. You would expect that the contacts of those who would be friends or that would be family members would have a higher likelihood of being positive. And what they found was only 3 new cases. And of those 3 new cases, what they found was that they had other reasons that they would be positive for COVID-19. But here's the kicker. What they did then after that was they tried to culture virus from 108, so half of the patients. And what they found with those folks is that all cultures were negative. So this very, very unlikely rules out infectivity. So what they said was, based on active monitoring, epidemiological investigation, and laboratory testing of re-positive cases and their contacts, no evidence was found that indicated infectivity of these re-positive cases. So at this point, it's looking like that those who have a re-positive test or have tested positive again are more likely to be associated with an incomplete clearance of genetic material of the SARS-CoV-2 virus that's picked up with PCR. More importantly, infectivity appears to be unlikely based on these studies and studies like this, and based on what we refer to as repositive testing. So this is great news, and I think is going to help with infection control type issues moving forward. So this was a study that I loved, and what it was looking at was how community leaders and their response help in Central and South America to fight the pandemic. So let's shift. Let's go down. Let's go down to the Southern Hemisphere. So in some countries, looking to its national leaders for control and management of the COVID crisis, there has been a dismal failure. For example, Brazil and President Bolsonaro has downplayed the pandemic and urged citizens to abandon social distancing. Now, as a result, Brazil is the second to the U.S. in the number of cases in the world. And as a quick aside, please continue to watch Brazil. Their cases are going up, and their mortality is going up, and the line is very, very steep, and it's heartbreaking for me. So now, as a result of the president's lack of leadership, the country has looked to community leaders and local officials, as well as private donors, to lead a thoughtful response to the pandemic. And these leaders are really doing an amazing job. They have assigned neighborhood leaders to monitor the health of groups of families, and they've established and trained a volunteer network of emergency first responders on how to assist sick residents by pointing them to receive care via telemedicine. Now, some are also being provided places to quarantine, including public schools that have been retrofitted for that purpose. This helps individuals to be cared for who don't require hospitalization while protecting their spouses, significant others, children, loved ones that they reside with. Now, it's that type of guidance and isolation that is limiting the danger to others and controlling spread, and I think it looks great. It works wonderfully. Now, there's also donors who've made astounding financial contributions. Brazilian companies, philanthropists, and crowdfunding campaigns have donated over $1 billion so far to the COVID-19 response. And authorities are also stopping evictions, thankfully, and guaranteeing access to water, again, thankfully, and halting anti-drug police raids. These efforts are being credited with keeping the infection from worsening. Also, Brazilian mayors have also attended webinars with mayors from South Korea, Argentina, Portugal, and Italy, and shared ideas. How awesome is that? And they are providing income assistance and housing the homeless in hotels. Now listen, outside of Brazil, across Latin America and in the Caribbean, where there are about 113 million people, that's nearly 1 in 5 who are living in slums, health experts are saying that COVID-19 infection rates are understandably higher due to poor nutrition and cramped housing. It is a combination that makes for the perfect environment to transmit the virus. That's why poor neighborhoods see nearly a 30% higher infection rate. That's also inspiring communities to work together, because there's groups that are coming together to perform online concerts to raise money for food and hygiene kits. How cool is that? And in other countries like Colombia and Chile, Argentina, Ecuador, community leaders are working to protect utility shutoffs for tenants who just can't afford to pay their bills. Now, while the situation is dire in so many places, the individual spirit of care and action that private citizens and community groups in Central and South America are taking is really an unexpected bright spot and makes me feel hope. So it's worth our while to not only recognize these individuals who have taken the burden onto their shoulders to manage these desperate situations, but to also applaud them for not being afraid or intimidated by their governments to take on these massive challenges. So please stay on the lookout for these regular updates, and to read more from the sources used in this report, go to acoi.org/COVID-19. Together with the ACOI, we will help you have the latest information to help you respond to your patients and stay on top of the crisis. As always, please feel free to reach out to me at madery@mac.com. Please stay safe. We can do this together.